Hopefully I'm going to give you a bit of a whistle-stop tour about what happens in Marie Curie, in Yorkshire particularly, but also some of the things that we do nationally, because obviously Marie Curie is the leading end-of-life charity in the UK. So we have services across the whole of the UK. So just to give you a bit of an idea of what we do in Marie Curie, we've currently got 8 hospices across the UK. We have numerous hospice care at home and urgent hospice care at home services. I will explain a little bit more about what they are as we're going on. We also have companion services, which are volunteer-led. We have a very large information and support service, which is through our website, but also through telephone support. We do a lot of research in Marie Curie around end of life, and a big part of our work is also around policy and campaigns. So we take the research and the information from all the services that we deliver and campaign to government for better end-of-life care for all. I have put the link to the website on the bottom there. So I'm happy to share the slides. So if anyone does want to go onto the Marie Curie website, they've got the link there available. Just to tell you a little bit about us in Yorkshire, Marie Curie in Yorkshire is led by us 3. So there's Becky, who is our medical director. Becky is a consultant in palliative medicine and works across the whole of Bradford and Airedale, and is on call for the Bradford and Airedale service as well. Our medical directors and our consultants rotate across the services in Bradford, so they work in community, in the hospital, and also in the hospices, in outpatients, inpatient units, and across in Bradford in our team React as well. So Becky is also due to go on her rotation into community shortly. So we'll be having a new medical director, Ellie Kane, who will be starting with us in May. Now, Ellie is already a consultant on our inpatient unit, so is already very familiar with Marie Curie in Bradford. Becky's role not only is managing the medical team and all the patient care in the inpatient unit and outpatients, but also is involved in research, training and development of all the doctors, and also is responsible for patient records. There's myself, and I manage the community and volunteer-led services in Marie Curie. I'm part of the senior leadership and management team, and my responsibilities also include health and safety, finance, support services and facilities, and place-based service integration. So making sure that the services across the whole of Yorkshire integrate with the services that we have in the hospice in Bradford. And a big part of my job is around service development. So looking at gaps in service and how can we fill them, and how can we make sure we're reaching as many people with end-of-life needs as we can. And I work really closely with both Becky and also Rachel, who is our head of nursing and quality. And Rachel takes responsibility for the hospice services and our React service. She's also a member of the senior leadership team and management. She's our registered manager with CQC, so takes responsibility for the quality of services that we provide and patient experience, and also a large part of her job is service development with myself. So moving on to what I'm going to talk to you about, we have lots of different services in Marie Curie in Yorkshire, and I've split them into 3 different sections, so we'll go through each section in turn. The ones that are internal in the hospice, the ones that are our volunteer services, and also the services that we deliver into the community. And as you can see from this slide, there's quite a lot that goes on. So starting in the hospice, I'm just going to go through what our inpatient unit is, our outpatient department, our bereavement support, children and young people support, patient and family support team, our allied health professionals, and our complementary therapy. So I don't know whether anyone's been to the Marie Curie Hospice in Bradford, but we're in Barker End, just off Leeds Road. So we're in a very inner city area, an area of high depravity. So we have a lot of deprivation around us, a very, very poor area, very multicultural area as well. And the hospice sits in the middle of that. But as you can see from the pictures, it looks, you know, the building itself is lovely and it's like a little oasis on top of the hill. If anyone has been, you really don't realise that you're in the centre of Bradford when you come to the hospice. Our inpatient unit has got 12 beds. All of our beds are single ensuite rooms. We have a full team of nurses and medics that are supported by the rest of our teams in the hospice. The average length of stay for patients in the hospice is around 2 weeks. So in 24-25, we've just got our final figures through. So the average length of stay for most patients was 16.2 days. 50% of those patients will actually go home and may come back into hospice at other times. And 50% of those patients will stay for end-of-life care. Our services offer specialist palliative care and end-of-life care, which means that the patients often come in to us for pain and symptom management that can't be controlled in community. They might have emotional, psychological or spiritual distress, and they need some additional social support for the patient and also those close to them. We also provide some palliative rehabilitation to people that have difficulty with mobility or regular falls, and our allied health professionals can support them to be more mobile. And we offer end-of-life care as well for people. Some people do not want to die at home, and that's a small minority of people that actually don't want to die at home. So we do try and support people to die in their preferred place of care as much as possible, but inevitably people will come to the hospice, maybe for some of the other reasons, and then their condition deteriorates and they prefer to stay with us. And some people don't want to die at home and prefer to be somewhere where they know they're going to get that 24-hour care and support. But nationally, the amount of people that die in a hospice is a very small amount. It's currently around 5% of the population that will die in a hospice. We do accept referrals from all healthcare professionals across Bradford. So that can be from the hospital, the GPs, other palliative care nurses, and other non-cancer professionals as well. So we will see people with cancer, but also non-cancer. And we know that people with a non-cancer diagnosis sometimes will have more difficult symptoms than people with a cancer diagnosis. Our outpatients department runs from Monday to Friday, and we have several different outpatient groups and support groups and clinics running throughout the day. Our clinics are, again, specialists in palliative care, so around that pain and symptom management and emotional support. We also run a motor neuron disease clinic, a Parkinson's disease clinic, and lymphedema specialists as well. And the lymphedema nurses come from the Care Trust, and they actually provide their clinics in our setting just because it's an easier place for people to go to and provides that integrated care. Our outpatient groups, as you can see, we've got quite a lot and we're always developing more. But our main ones are Better Breathe, which particularly is for people with long-term end-of-life conditions that affect their respiratory system, so COPD, pulmonary fibrosis, so people that have problems with their breathing. We have Men's Shed, which is a support group for people with a terminal illness, the people that are important to them, and also bereaved men as well. And they come together and it's a peer support group, so they support each other while doing various crafts, photography, and sometimes it is just a game of pool or snooker, and they just support each other's. The opposite to that is run at the same time, which is the Ladybirds, which is the women's version of the Men's Shed. We did recognise that when the men wanted to come together, and we did this as a research project, that actually the women were feeling quite left out and they wanted a group as well. So we set up Ladybirds at the same time. We do a wellbeing session where people come, and it's normally a programme of 6 weeks where we support people with various different aspects of their illness. So how to manage their fatigue, how to manage finances, and also how to manage different symptoms that they get. And we have various members of our hospice and community teams that come in and do talks and answer questions and support people. We have a carers group. We know that people, we rely very heavily on unpaid carers, and people's families support the person that has a terminal illness. And the carers themselves find it difficult to get the support that they need because they're obviously caring. So our carers group enables the person that is the carer to bring the person with them that they care for, and we will support the person that's being cared for while the carers go off together and have some peer support. We have a baking group, which is probably our most popular group, where people will come together and make food together and then eat together. And we have a new group coming this year, which is part of Bradford Culture 2025, where we have a creative therapist coming into the hospice a couple of hours a week to provide some support for people who want to be creative and utilise art as a way of expressing themselves. We also have a heart theory group and a gym drop-in. So again, people who may have been very active that want to continue to go to the gym may find that their local gym that they used to go to might have restrictions because of medical needs. And also they may feel very self-conscious because of their illness, that they don't want to be in that environment anymore. So we do have a drop-in which is supported by our allied health professionals, so people can come to the hospice and use our gym facilities. We have a gardening group which is very popular at this time of year and throughout the summer, not so great in the winter, but again helping people to connect with nature and get out into our beautiful hospice gardens and do some gardening together. We have a neuro dance group, which is for people that have a neurological condition that can come and use movement and music to help them to manage their symptoms, and a progressive supranuclear palsy group, which is another neurological condition where people can come and have peer support. So lots going on in our outpatients department. Our inpatient unit and our outpatients unit are supported by our patient and family support team, which is a team of social workers who have a responsibility for caring for people's social needs, which might be to do with housing, finance, family support. Sometimes it can be to do with discharge planning and pre-bereavement work as well. They also have a responsibility for safeguarding and to make sure that our patients and their families are safe and feel supported wherever they are, and obviously highlight and escalate any concerns that we have if people are not safe. They have a role as well in what we call freedom to speak up, which means that if there's any concerns with care in the hospice, then our team can go to, and it doesn't mean that they can't go to anybody else, but there's specific people that they can go to raise concerns that will be addressed in a safe manner. We also provide adult bereavement support and counselling services with teams of volunteers and student counsellors that support with that. And Yvonne, who's in the picture here, provides our children and young people support, both pre and post bereavement. So any families that are affected by terminal illness will receive support through Yvonne and her team. Am I going too fast, or is this okay for everyone? Yeah. Okay, I'll keep going. Allied health professional team, as you can see here, we have a really lovely team of allied health professionals, our physiotherapists, occupational therapists, who are supported by our therapist assistants. And we also have a complementary therapist, Christine, who is in the purple on the picture. And we have Ria, who is our motor neuron disease coordinator as well, who helps support patients across the Bradford region who have a diagnosis with motor neuron disease. The team currently work just within the hospice, but we are expanding the team further later on in this year to develop a service for patients in community as well. Meanwhile, I just have a quick drink. Our support services, we have lots and lots of national support services that support our teams, including a quality and risk team that look at the quality of the care that we provide, and we are benchmarked against other services and also each other within Marie Curie to make sure that all of our care is safe and of really high quality. We have a learn and develop team that make sure that all of our staff are up to date and current with their training, and that have all of the training and development that they need to fulfill their roles. We have the research and policy team, which I've mentioned previously, that do a lot of research, and we've currently got lots of research going on in Bradford, which help to make sure that we find new ways of supporting people, both either emotionally or with their pain or symptoms. And our information and support team are available for people to contact. So they don't actually have to have any contact with their hospice particularly, but they might want some support externally. And we have various services through the information and support line. There is a bereavement support line, companions by the telephone, so just some befriending support. And we also have professional knowledge zone on the information support website, where people who are in a professional role can get more information about how to care for people in the last years of life. Our health and safety is obviously our priority, to make sure that our staff, patients, service users and visitors are kept safe in our hospices. And that's a huge part of my role, to make sure that the hospice is functioning to the best standards that we can. And that includes everything from fire safety to water safety, to make sure that we have adequate car parking, and to make sure that we are not putting any people at risk who come into our premises. Obviously, as any department we have our people and organisational department, that is the HR behind the system, and we have what we call business partners. So each service in our region will have a business partner who is our HR business partner, who helps support us with our people operations. Technology, obviously, to run a national charity, we need to connect with everybody. So we have a large technology department that helps us to make sure that we have all the IT and infrastructure that we need to work. And we also have an income, innovation and engagement team that help to get the message out. So help develop our websites, help develop our campaigns, ensure that we have the income and the money that we need to continue to provide the services, but also look at how we can expand and do things better, and how we can make sure that we're reaching more people in different ways that have end-of-life needs. Locally, we have lots of support services as well. So as well as our nursing teams and our medical teams and our AHP teams that we've mentioned, we have a really fantastic catering team that provides really high standard food for our patients, and all of our food is standardised, allergen tested, and can be modified for the patients that have difficulties with swallowing or different needs. And we cater for lots of different types of dietary requirements, so we can provide vegan food, halal food, kosher food as well. So our head chef is fantastic and spends an awful lot of time with the patients on the ward, finding out what their dietary requirements are, what their likes and dislikes are, and how they like their food to be presented, to try and ensure that people get the food that they like, so that they're not overfaced with the food, and also getting a really nutritious meal. Our administration team help to keep the hospice running on a day-to-day basis, and our housekeeping team are absolutely paramount to making sure that the environment is clean, and also reduce the risk of infection for people coming in. And I think one of the things that I noticed when I first started here in Yorkshire, very Curie, was when you come into the hospice, it's absolutely beautiful, really clean and tidy all the time. Our maintenance team help to keep the building functional, help to make sure that the grounds are kept really well, and make sure that all of our facilities are working to their best capability. We have a coordination hub which coordinates our community services. So when I talk about community services, I'll talk about them a bit more. And our business services, who deal with contracts for us. So we have lots of different contracts with lots of different organisations that help us to provide support and care. The other thing that we have in Bradford is a clinical educator, Caroline, who supports our staff internally with clinical skills training to make sure that they're always up to date. We do have a lot of volunteer services, and our main volunteer services in Bradford are really integral into our the way that we actually support patients. So volunteers contribute all levels of the organisation. So we have volunteers right up at trustee level, and then we have local community helpers as well. And in Marie Curie, we've got over 5,000 volunteers, and we rely on them really heavily for their commitment and passion to keep our services running. We have, particularly here, we have feedback volunteers. So we want to make sure that we're doing the best possible care that we can. And the only way that we would find that out is by getting feedback from the people that use us. So we have volunteers that will contact patients and their families to find out if we've done a good job. And if we haven't, so that we can get that feedback so that we can utilise that to improve our services further. So the feedback that's negative is just as important as the positive feedback to us, because then we know what we need to improve on. We have community fundraisers, who are the people that you'll probably see out with the tins and the buckets, dressed all in yellow with daffodils on, who help to bring in our funding that we need to keep going. We have gardener volunteers who keep our gardens really looking lovely, and we have an area that's paved, we have an area that's very much flowers, and then we also have in the back of the hospice, we have a really lovely koi pond for patients to go and sit in their families, which makes it a really nice area for people to relax. We have volunteers like Josie here that helps with meals, providing meals for people, helping to give them out and provide tea and coffee. We have admin volunteers that help our services to run, and some of our volunteers also help with reception as well. Our complementary therapists, we have one complementary therapist that's paid, which is Christine, but then she also is currently recruiting for a team of voluntary complementary therapists as well. Excuse me. We have hairdressers. It's really important that our patients feel cared for, and their appearance can be really important to them. Sorry, I've got a tickle. So we have a hairdresser as well that helps to support patients with their personal grooming. We are currently trying to recruit drivers, which is something that we don't have at the moment. But one of the problems we have with people coming to outpatients is accessibility. Because of where we are in Bradford, there isn't any buses that bring you straight to the front door. And taxis can be quite expensive for people. And because we are in a deprived area, not everybody can afford to get to the hospice. So what we're trying to do is recruit volunteer drivers that can pick people up and bring people to the hospice for their sessions. And then we have the retail volunteers as well. And we've got several shops around Yorkshire. And retail brings in a large amount of our revenue so that we can continue to provide services. All of our volunteers are trained and are supported by a line manager within the department that they work. They have a lot of peer support and relationship building events, and we have celebration events for them as well. And in June this year, we have our Volunteers Week, and we are putting on an event in the hospice for our volunteers to thank them and to celebrate the achievements that they've had through working with us. Just a few pictures here of some of the types of fundraising that we do. A large element of volunteering comes through fundraising as well. And this can be people from running marathons to our partnership with Morrison's that is running at the moment, to street collecting, for people giving us legacy and money through their wills, and for people that want to raise money for Marie Curie as well. And we have our shops. So we've currently got 4 shops, one in Darley Street in Bradford, one in Shipley, one in Sheffield, and then we've got our new shop that's just opened in Chapel Allerton in Leeds, which is brand new to Marie Curie, and it's called Edit. And this is seconds and pre-used designer clothing. So a really lovely shop to go into. So something a little bit different. So Marie Curie at Home is our companion service. And this is where we match trained volunteers with people with a terminal illness and a prognosis of 12 months or less. And the volunteers will visit people in their own homes to offer companionship, emotional, practical support, and then can signpost to other services as well. Our volunteers generally spend 3 hours every week or fortnight with their clients, and it's all completely free of charge. And one of our services is in West Yorkshire, and Liz, who is our companion coordinator, manages that service and matches volunteers to clients across the whole of West Yorkshire. And they're people with very similar interests and backgrounds. So we have a couple of young gentlemen who like to go to the football together. We have people that like to go to the theatre together. We have some that like to just sit and read the paper together. And it's whatever is the client's wish, that we will match somebody up with a similar interest so they can do that together. Excuse me. We also have our free companions over the phone service. So not everybody wants a face-to-face contact, and some people would prefer that by telephone. So we can provide somebody that will call somebody and just have a telephone conversation with them for, half an hour every week, so that they have that connection as well. We have a new service in Harrogate Hospital, where we're partnering with the Harrogate Hospital, providing patients and their families who are in the last days and weeks of life that are in hospital with the same kind of companion support. So Mel is our volunteer service officer in Harrogate, and she's currently recruiting volunteers in the Harrogate Hospital that will be able to go onto the wards and provide some emotional support for the patients and their families, to just be there and give some companionship, so that sometimes the families who have been staying in hospital can go away, have a shower, have something to eat, get some fresh air, nip home to do what they need to do, and know that their relative has got somebody with them. They'll also provide some practical support, so help with visitor parking permits, and signposting to other organisations and support services. And this service is going really well. It's a brand new service, and since January we've already supported over 35 patients in hospital. So it's looking to be quite a busy service. So we've done the inpatient unit and the hospice services, we've done the volunteer services, but by far the majority of our services from Marie Curie in Yorkshire are community based. We have our hospice care at home service, which is our largest service, and this is where we actually have trained healthcare assistants and nurses who provide care for people with a terminal illness overnight in their own home. The majority of our services are between 10 p.m. and 7 a.m. and one of the nurses will go to the patient's home and care for the patient overnight, so that the family can get a good night's sleep and have a good rest. As we rely more and more on unpaid carers to look after people, we know that when caring for somebody with a terminal illness, it's exhausting, it's hard work, and it's emotionally draining. So having 1 or 2 nights a week, good night's sleep, can really help them with their resilience to continue with that caring role. And it helps people to stay at home if that's where they want to be. We currently have services that cover the whole of North Yorkshire, the East Riding of Yorkshire, so right out into the coast, Whitby, Scarborough, right down to Bridlington, throughout the Vale of York. We have services across Bradford and Airedale, and into South Craven, in Calderdale, Kirklees, and also in Wakefield. So the only area in West Yorkshire that we don't currently provide a service to is in Leeds. We did have a service in Leeds up until last year, but Leeds Community Trust decided that they wanted to provide that service themselves. So the service is still there, but it's under the Leeds service rather than Marie Curie now. We also have our urgent hospice care at home, which sometimes can be called our rapid response service. And we have one in partnership with Calderdale and Huddersfield Trust. And what we do is we provide a rapid response service, which is 7 p.m. to 8 a.m. for any end-of-life patients in Calderdale. So it might be that the patients wake in the middle of the night in pain and need some medication. They would ring the single point of access, which is a single number, and then the nurses will be alerted, and then they will go to that patient and provide the care that's needed till the patient's settled. So they may see 10, 15 patients in one night and go around to where their need is. And again, this prevents hospital admissions and people feeling alone and distressed in the middle of the night. In Bradford, we have a really unique service, which we've been piloting for the last 3 years, and have just confirmed that this service will continue with funding from Bradford Teaching Hospitals. The service was trialled with funding from Macmillan Social Finance and the Lottery Fund, and it's a palliative care virtual ward, and it's called our REACT service, which is a responsive emergency assessment and community team. And you can see a few of our team members there, Moira, Helen and Donna, and the team go out to see patients who are at risk of being admitted into hospital. So we can pick people up through community referrals, but by far the majority of patients are picked up through the emergency department at Bradford Teaching Hospital. So patients may arrive at the hospital with distress or symptom problems, or it may be a medical issue that's happening, and our team will go in and support that patient to go back home quickly and provide crisis intervention for 72 hours until the patient has more support services around them and until their crisis has settled, and then they will discharge them. What we found already is that we've reduced hospital bed days in the final year of life by 53%. So it's really helping to keep people out of hospital. People don't want to be in hospital at the end of their lives. They want to be at home with their families. So it makes a really big difference. What we're also finding through the service is that we are seeing people from a very different diverse background to what we see in the inpatient unit. A lot of people in different cultures prefer to be at home and cared for by their families, so don't actually access traditional hospice inpatient care services. But what we are doing through REACT is picking them up through the emergency department and being able to support a different cohort of patients in community. And as I mentioned before, we've got a couple of new services starting this year. The community allied health professionals that I mentioned previously, which will be an expansion of our physiotherapy and occupational therapy services to support people in community. And we have a new service which will start, which is called an early identification and advanced care planning service. We know that through several GP surgeries have significant amount of patients on their books that will have long-term conditions and perhaps have multiple hospital admissions, lots of deteriorating conditions, but actually haven't been identified as being within the last few years of their life. So we're going to start working with the GP surgeries in Bradford to try and identify who these people are so that we can provide that holistic support and perhaps do some advanced care planning with the patients so that we can look for the future and help to give them some choice about how their care will look and give them the options of how they want to be cared for. We have lots of different social media platforms as well. So we have Facebook for Marie Curie. So we have a Yorkshire Facebook. So if you are on Facebook, please have a look at that. We put all our updates of what we're working with in there. We have an Instagram account, Twitter account, and obviously we have our internet website as well that has all the information about all of our services on there. Our website is currently being reviewed and updated, so there's lots of new information on the website as well. Another aspect of what I do is I work with the West Yorkshire Hospice Collaborative. And the West Yorkshire Hospice Collaborative is made up of 10 hospices across the whole of West Yorkshire. And as you can see, they're all on here. So we work with Wheatfields, Manorlands, Kirkwood, Martin House, Forget Me Not Children's Hospice, Overgate, Wakefield, Prince of Wales and St Gemma's. And what we do as a hospice collaborative is that we were actually formed in 2020 in response to the COVID pandemic, sharing ideas and support about how we would work through that pandemic. But we've continued to work together following that, And the 10 hospices are made up of adult hospices, children's hospices, independent hospices and national hospices such as ourselves, Curie, and the Sue Ryder hospices as well. What do we do? I think the main things that we do is around building resilience. When we know that a lot of services are at risk at the moment, particularly with the rising costs of services and the decrease in funding, we want to try and look at how do we work with our integrated care boards to recognise the vital work of hospices, to try and get a new model of financial sustainability that can work with, so that we can shape and jointly commission services together. We're more powerful as a collaborative team than we are as individual hospices. So we're really working hard at campaigning to the integrated care boards together. And it helps us to deepen partnerships. So we are doing collaborative work with each other and creating services across boundaries so that there shouldn't be any postcode lottery about what patients will receive. So that we're also looking at providing equitable services wherever people within West Yorkshire live. Sorry, I'm losing my voice now, so I'm going to stop.